Good afternoon, everyone, and welcome back here at ECCMID TV, brought live to you from Pavilion 1 here at the ECCMID Congress Center in Lisbon, Portugal. My name is Judith Cohen, and I am still your host here at ECCMID TV Broadcasts. And I'm very happy to introduce to you my next guest, who is coming to our studio live via a stream, all the way from Sweden. This is Lisa Mellhammar from Lund University. Welcome, Lisa.
Thank you very much.
I'm very pleased to have you here as my guest because your poster was one of the posters that was selected as a top poster this year's ECCMID. So congratulations on getting that acknowledgement.
Thank you. It feels good.
Can we just chat a little bit about your poster and your research?
Yes.
I understood that the title of your poster is Validation of a New Infection Definition in Assessing Evidence of Infection in Patients with Suspected Sepsis.
Yeah.
It's a tongue breaker. Can you tell us a little bit more about the new infection definition? So why was there a need for a new definition?
Yeah, the problem is that we do have now quite good definition of sepsis, and within sepsis you have to have an infection, but there are no definition of infection. So that is the background. And when I say that, it's not that they're completely missing a definition of infection. There are one developed by the International Sepsis Forum, but that one is actually for sepsis in the intensive care units.
Okay.
And most sepsis patients are actually treated outside the intensive care, so it cannot be applied very often. And also it only defines six foci of infection, and I mean there are so many more. So what we tried to do was to make it more user-friendly, something you can use almost everywhere, and then we validated it because other definitions of infection have not been validated, so we thought that was important.
So what was new on this in this definition? Which new?
Yeah, I think the big difference was that we tried to make it really simple, and so that it can be easy to use, and also that we had 13 different foci of infection. I think that was also, so it's more, it covers more. Yeah. And I think those definitions by the International Sepsis Forum, they are good if you find the microbes, but it's actually like 1/3 of the sepsis patients you don't find the microbe that causes sepsis. So then, and these patients need to be in studies as well. So I think we saw we saw that it was room for this
improvement. Yeah, so it's a very practical research question. Yeah. Well, I think that the question on everyone's lips of our viewers is, did you manage to validate it? Is this a potential useful new definition for these types of patients?
Yeah, I think so. But one thing that was hard is that we don't really have a gold standard for infection in sepsis research. So that is a problem when you are doing a study and you don't have a gold standard. That's really, really difficult. So we validated it both for the International Sepsis Forum definitions of infection in the intensive care, and also for the caring physician's diagnosis.
And were those definitions very different?
Yeah, a bit different. I think the biggest difference between our definitions and the International Sepsis Forum is that we have more foci, but also it's in our definitions it's easier to get the pneumonia diagnosis, but it's harder to get the urinary tract infection diagnosis. I think that is the major differences.
But you tested it against those the guideline definitions?
Yeah, we tested it against both. Since we didn't have a gold standard, we thought we better do that. But because it's the closest we get to a gold standard. So that's what we used. And we could see that our definitions performed we used it in different settings, both in a international multi-center study, observational study, and we could see that our definitions worked better or as well as the other definitions. It was never worse at least.
Good. Yeah. So what will be the next steps now? Will you be proceeding with this new definition, and how will you be doing that?
Yeah, I mean, I don't believe that this is the final definition. I think they need to be even more validated and perhaps modified. I'm not sure we have the best
not pinpointed it yet. Yeah.
So I mean, the work will go on, but I think what we need now is to validate it even more in more settings, in more studies, because we did it in 994 patients, but that's really too few actually. For less common foci, we didn't get enough patients. So there's
still more work to be done before it's time for implementation. Yeah. Well, very interesting. Well, congratulations on making your poster a top poster. I hope many of our viewers have seen it, have read it, and have learned from it. Thank you so much, Lisa, for taking the time and coming to our studio and explaining a little bit more about your research. And for our viewers, thank you for watching. We are almost at the end of ECCMID TV's program. We will be back at 3 o'clock when Professor Jacob Morangalan and the ECCMID program director and myself will be wrapping up ECCMID TV for this year. So that will be our final broadcast, this 32nd ECCMID. So hope to see you soon so we can close off this wonderful 4 days together. So see you at 3 o'clock.